Greetings, sir. This is for assessment of the fetal kidneys. As you can see, the fetus is in a prone position, which is very ideal for looking at the kidneys. These three are the dots of the vertebrae, vertebral body and posterior element. These are the ribs. These are the level of cardia. Now I sweep down and I get the stomach bubble. So this is the left side, and as I go down, this is the adrenal gland that is seen here on the right side, but renal echoes are not seen. So whereas on the left side we see the adrenal, this is the adrenal, and below the stomach, and this is the renal echoes. So we don't see a renal echoes on the right side, and we go lower down, the renal echoes are still seen till here. So that means there is a non-visualized fetal right kidney. Left kidney is visualized in the left renal fossa, and as I go for a sagittal view for the fetus, I see that this kidney is slightly larger than usual, and so there is a possibility of a crossed fused ectopic kidney when we see this. So once again, look at the vertebrae, look at the ribs, look at the stomach bubble, go down, you see the adrenal gland here. Adrenal gland, we should see adjacent to the adrenal gland renal echoes. Here renal echoes are seen, and also take help of a Doppler to look for the renal artery. This is in the sagittal plane. We can see the kidneys here. That's on the left side, the stomach bubble is seen. Whereas right side, we don't see a renal echoes here, right side. So it is a unilateral kidney, which is slightly larger. And we now try to look at the coronal plane. When we try to look at the coronal plane, you can see that renal artery is seen here, whereas on the other side it is not seen. So it's a unilateral kidney which is a little larger. So this is the renal echoes, this whole length, and this is the renal artery. This is how we need to assess the kidneys in all the three planes during our assessment. And one sign that is important is the flat adrenal sign. That is, here you can make out this hypoechoic line is the adrenal gland. Adjacent to this we should see the renal echoes. So we don't see any renal echoes here. So when we trace this, this is called a flat adrenal sign. Whereas here the adrenal is not as flat as this here. So this is a flat adrenal sign. This indicates a unilateral kidney or a cross-fused ectopic kidney. Thank you.